Hi, my name is Kurt, and I have a YouTube channel. And on that channel, I try and show folks how to play different baseball simulations. Um, Sometimes I do book reviews of baseball books, either fiction or nonfiction. Try and do those once a week, and basically help people make informed decisions about simulations for baseball that they may want to pick up for themselves. But that's not what this program is about. This program is about a medical condition that I have that I have not talked about with very many people before, but in doing some searches both online and on YouTube, it became very, very obvious to me that there's not a lot out there in terms of um, patient perspective on this particular condition. And that's the purpose of what I'm bringing today. I'm not interested in your solutions. I'm not interested in a product of any kind. So if you have that and you want to put those ideas in the comments section, don't, because I will just delete the comments. If, on the other hand, you have something to offer in terms of maybe knowing someone who has this or having it yourself and just being interested in hearing more from me about what my journey has been like, I would be happy to say more about than what I'm going to say in this video about my particular condition. The purpose of this video is to provide support for people that have this or support for people that know others that have it, and to give you some perspective on what it's like from the standpoint of someone who actually has this condition. But there's a lot more detail that I can go into, and if you'd like me to do that, I can do that in subsequent videos. Please indicate that if you're interested in the comments below. The condition is called central apnea. Now, it is a sleeping disorder, but it is not the most common one. Central apnea is different from one of the other kinds of sleep apneas, which is called most commonly obstructive apnea. Obstructive apnea is the one that you've probably heard of where folks have a terrible time snoring and getting oxygen while they sleep because they have a blockage somewhere in their breathing process, and it prevents them from getting quality sleep. The remedy or the treatment for that oftentimes, not always, is a breathing mask. I have something called central apnea, and central apnea is different from obstructive apnea because it's basically centered in my brain. And what that means is that when I sleep, my brain tells my body to stop breathing. And it does this. I've done, I think, 5 different sleep studies, and they count the number of times that this occurs in a night's sleep for me. And that number is, in the studies that were done with me, is never less than 45 times per night. So what that means is that I stop breathing 45 times on average or more in a given night. And then, in my experience, I am either consciously aware of this and gasping for air, or sometimes not, and I'm able to continue dozing or whatever it is that I do. According to the sleep studies that have been done, I don't get REM sleep, which means that I don't get restorative sleep. And in terms of sleep, it ranges for me on a nightly basis between 2 hours and maybe 4 on a good night, maybe 5. But it's not the restful, restorative sleep that human beings need to continue to be able to function. Now, for me, in my experience with this, I was diagnosed about 5 years ago, not 5.5 years ago. And I don't know, and I can say a lot more about the treatments that have been tried for me and the different sort of approaches that have been taken to try and treat my condition, but I don't know, in short, if I have had this condition my whole life and just assumed it was normal, or have I had some kind of traumatic brain event that has created this condition in my brain to exist. As you might imagine, this has led to, pretty directly, a number of related medical conditions and concerns. But the trigger for all of them has been the condition called central apnea. And I don't see a lot out there in terms of support for folks that have this. And it bothers me from the standpoint that if you are a young person and you think you're not sleeping properly, you may not even know you have it. I certainly didn't until 5 years ago or so. And I didn't even come up with the idea to have a sleep study done and get tested for this. It was my doctor who suggested it, and I was skeptical that there was even anything to this because I didn't think there was anything special about my sleep. Sure, I woke up sometimes, but doesn't everybody, was sort of my way of thinking. Well, I was wrong about that. And if you think you might be having difficulty sleeping or even suspect or wonder, I would really, really, really encourage you to talk to your doctor and get a sleep study done to see if you have this particular condition. Because if you do, and something can be done for you, then it should be done, because it will lead to other problems if you don't at least try to make it better. So it's called central apnea. It's a neurological condition. I can go more into this. If you'd like, please indicate that in the comments. But if you're watching this and you suspect that you may have some sleep-related issues, the purpose of the video is to really encourage you to follow up on that, because this isn't a way to go about your life, and it's caused a host of other related problems for me, and I would like to be able to encourage folks to be able to take some steps to try and alleviate it in themselves. So, with all that said, thanks for watching. And if you have questions, or if you'd like me to say more about what's happened in my particular journey, let me know in the comments below. If you're selling a product, or if you have a wonder drug for me, spare me. But if you have a serious question and would like to know more about what my experience has been like, please let me know, and I will create another one of these videos where I talk more about my medical journey and what that's been like, or answer your questions as best I can. Thank you so much for your attention and your thoughtful response. And feel free, if, like I said, to contribute whatever you're concerned about this particular condition. Thank you again, and have a nice day.